Hello and welcome to Healthcare Matters, the internet television program that explores the intersection of medicine and the law. I'm your host, Mike Matray, and today's guest is Dr. Richard Anderson. Dr. Anderson is the Chairman and Chief Executive Officer of the Doctors Company, the nation's largest physician-owned medical malpractice insurer. Welcome to the program, Dr. Anderson.
Thank you very much. Nice to be here.
How has the medical liability landscape and the practice of defensive medicine changed in the last 15 plus years since your article, Billions for Defense, The Pervasive Nature of Defensive Medicine, was published?
Well, in my mind, it hasn't changed one bit. And I think, and the reason I say that is that I believe that defensive medicine, and I believe that virtually every physician in the United States would tell you the same thing. It's one of the ironies about defensive medicine. The people who practice medicine tell you they practice defensive medicine. They don't hide it. They don't say, no, not me. They don't say, defensive medicine, what are you talking about? No, all of us, to a man or woman, say that defensive medicine is pervasive. And yet, society chooses to continue to debate whether or not it exists. It's really a very strange notion. So I don't see, so I wouldn't change anything that I said 15 years ago. And I do believe that even today's tort reforms don't affect defensive medicine much. And the reason I believe that is that physicians' aversion to the current medical legal system is so strong that even if you say, well, claims are only half as frequent as they were a decade ago, so why are you still practicing defensive medicine? It's because half as frequent is still way too high, and doctors don't perceive, put another way, the risk is way above threshold for the way most physicians practice. Best example that I can give is in that British Medical Journal article that you referred to earlier. They make the point, very interesting one, about how high the incidence of defensive medicine is in a number of first world countries, countries that we wouldn't necessarily, we think of England as having a very low rate of litigation. With a country like Italy, we hardly think of the medical legal system. Austria, we hardly think of the medical legal system. And yet, to cite 3 examples from their paper, doctors in those countries will tell you about 95% of the doctors in those countries will tell you that they practice defensive medicine. So what's my point? Well, the frequency of litigation in those countries is only about half of what it is in the United States today. So if they're practicing 95% defensive medicine with half of today's frequency, we're going to have to get claims down way, way further before physicians will back away from the notion of the need to practice defensive medicine.
Okay, well, that opens it up to the big question is, how do we change this? And if so, how do you recommend physicians in the medical liability community get involved in order to change this defensive medicine culture?
Yeah, I think, I think that there are a number of things. There are some specialty society initiatives that are based on thoughtful ordering of studies. And all of that is commendable, to sort of develop a medical consensus on what studies are necessary under what circumstances, and to really disseminate the view that shepherding resources is an important part of physician professionalism, and that we have to be thoughtful about the way we do these studies. And certainly there are more academic studies being done that are evaluating the utility of things that we used to do routinely, believing that they were effective, and finding out that, in fact, they're not as effective as we thought. So I think that there is a new emphasis on professional education, and all of those kinds of things can help. But the truth is, I don't believe that this change can really be effectuated from within medicine itself. It's going to take a cultural change. It's going to take a change where the first American reflex whenever any of us experience adversity, whether it's medical, whether it's a slip and fall on the street, whether it's a bump in a supermarket, whose fault is it and who can I sue? And until we change that cultural mindset, until we change the mindset that I'm leaving money on the table if I don't sue somebody, then I don't see really a profound shift. In other words, as important as I believe solving the problem of defensive medicine is, and I do believe it's fundamental, I don't have a magic bullet solution to it. I wish I did.
Dr. Anderson, thank you for taking the time to visit with us today.
Well, thank you very much. It was a great pleasure. Thank you.
I've had the privilege of attending a session that you delivered at the most recent PIAA Medical Liability Conference on defensive medicine and the healthcare transformations in the United States. You've written at length over the years about the negative impact of defensive medicine. You wrote an article in 1999 titled "Billions for Defense: The Pervasive Nature of Defensive Medicine." I think a good place to start would be to ask you for your definition of defensive medicine.